Welcome to the parent training video on the ABA skill of planned ignoring of junk behavior. For many parents, the idea of ignoring junk behavior feels as though you are choosing to allow your child to get away with unwanted behavior, or it may feel as if you aren't doing anything to help change the behavior at all. However, planned ignoring of what we refer to as junk behavior is actually very effective and an important intervention that will help reduce or eliminate these unwanted behaviors. Many times, unwanted behavior can happen in order to get attention from you. These behaviors can be anything that is disruptive or inappropriate, such as arguing, yelling, throwing things, or hitting. These unwanted behaviors continue to happen because they have worked to get attention in the past. So, by removing that attention, your child will no longer be motivated to continue with those unwanted behaviors because they aren't working to get the attention that they used to get. It is important to note that this intervention includes providing attention for appropriate replacement behaviors along with ignoring unwanted behaviors. For example, if your child attempts to get your attention by yelling, you would ignore the yelling and give attention to your child when they use appropriate replacement behaviors such as tapping you on the shoulder and saying, "Excuse me." The replacement behavior that you will give attention to must have been taught to your child before you can implement a planned ignoring intervention. The next part of this video will show you some examples of planned ignoring of junk behaviors. The first example shows a child who is throwing Legos to get attention. The therapist ignores the throwing of Legos and does not give the child attention until she appropriately raises her hand to request the attention. The appropriate behavior is rewarded with attention. As you watch these examples, keep in mind that the appropriate behavior has already been taught to the child. The therapist is not simply doing nothing, but is planning to provide attention when the replacement behavior occurs. Let's watch these examples now. If you need my attention, you can say, "Excuse me."
Excuse me?
Oh yeah, did you need something?
I don't understand.
Oh, okay. I can help you with the Legos. Sure. No problem. You can take them off and put them back on. Go ahead, you try it. If you need my attention, you can say, "Excuse me."
Excuse me?
Yeah, what do you need?
I'm not sure what to do.
Oh, okay, put the blue one on top there. Good job. Perfect. The next example shows a child tantruming for attention. The therapist ignores the tantruming behavior, gives the child some time to calm down, and only gives attention when the child appropriately requests it.
We don't have iPad right now, we can have puzzle or stickers. So you can ask for your iPad again. Thanks for asking, we can't have that right now. We have stickers or puzzle, which one do you want to do? Stickers? Okay, sit up. Hands down. Good job, there's your stickers. You can do some stickers.
As you implement planned ignoring of junk behavior with your child, remember that a replacement behavior must be taught for this intervention to be successful. Also remember that the decision to not provide attention to unwanted behaviors is the most important thing that you can do to decrease these behaviors that are motivated by attention. As you ignore the junk behavior and provide attention to the appropriate replacement behaviors, something called an extinction burst may happen. An extinction burst is when the unwanted behavior temporarily escalates or becomes more intense for a period of time before it goes away. If this happens, it's important to continue with your planned ignoring intervention until the unwanted behavior stops. To learn more about managing an extinction burst, you can watch the parent training video on extinction burst management. Your support of your child's ABA treatment is critical for successful outcomes. Be sure and ask your child's BCBA or behavioral technician if you have any questions at all with implementing planned ignoring of junk behavior. Thanks for watching and for supporting your child's treatment.